This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You know, we've learned a lot this month about the heart. It is, of course, Heart Month. We have covered heart attack symptoms. We've covered the importance of calling 911. We've covered programs that can help you keep your heart healthy. And as we're rounding out this month of sharing such vital information, today we want to talk about treatment when it comes to different heart conditions. With us this afternoon is Dr. Stephen Hearn. He is an interventional cardiologist and the co-director of the Guerreri Heart and Vascular Institute at Peninsula Regional Medical Center. Thank you so much for joining us today.
Thank you for having me.
Good to see you.
Good to see you.
Now, we're talking about something called, this really sounds complicated, the left atrial appendage closure device.
Yes. So to give you the history, this device is used in a disease called atrial fibrillation.
Okay.
It's a very common disease, common as you get older. About 5 to 6 million patients or people in the country have it right now.
Right.
And the problem with that disease is it predisposes you to having a stroke. It makes your stroke risk 5 to 6 times the average of the average person walking down the street. So to prevent that stroke, you usually or typically treat it with blood thinners. Unfortunately, blood thinners cause bleeding, and there's some patients that for whatever reason bleed from elsewhere in the body, commonly gastrointestinal tract, or they may have had a cerebral aneurysm in their brain that they can't take a blood thinner for, but they're still at risk for that stroke.
For the stroke, yeah.
So what this Watchman device does is it plugs a little thing in the atrium that's fibrillating.
Is that what this is?
That is. That's a Watchman device. It's called the Appendage.
And I'm sorry, you were saying it does what?
So it plugs a little thing in the left atrium called the left atrial appendage. It's an outpouching of the atrium, which is the top chamber that's fibrillating in atrial fibrillation. And we know from experiments that 90% of clots form in that appendage.
Okay.
And again, the reason for the blood thinners is to prevent that from happening. However, this is a mechanical solution that you can actually go into a patient's heart and place that device into their appendage, seal it off so that blood doesn't go in there and clot, and it's actually as equal to blood thinners and preventing strokes with about a 10% less chance of, or 90% less chance of bleeding.
So is there anyone in particular that's more eligible for this?
Yeah, so by FDA and CMS or Medicare criteria, you have to not be a candidate for a blood thinner due to previous bleeding episodes, and it has to be documented by 2 physicians, one the implanting physician and then the patient's primary care physician or family doctor has to say, hey, yes, Mr. Jones or Ms. Smith has had bleeding issues and cannot take an anticoagulant, and therefore they're a candidate to have this procedure done.
So in the same sense, are there people who cannot qualify for this?
There are people that technically you need to take a blood thinner for about a month afterwards while that sort of heals over. And if you really can't even be on a blood thinner for a month, you don't qualify. There's also certain anatomic exclusions. The appendage is a different size, different shape in every person. I'm amazed the more I do. So there's 5 different sizes of that device you have in your hand depending on the size of the appendage. So some appendages you just can't put it in. They're either too large, too small, and it just won't work.
I was going to say, this thing seems huge. What's involved in implanting it?
So it goes in through a vein in your leg. You go in through the right side of the heart. What's called the right atrium, and you make what's called a transeptal. It's a puncture. You put a hole from the right side to the left side. Okay. When the catheter is a little smaller than my pinky, it goes in, and you go from the right side, you go over by both, and under echocardiographic guidance, we have what they call a transesophageal echo, which is an ultrasound down the patient's throat while they're under general anesthesia. Right. That guides us, and then there's X-ray that we're able to see as well to point us to where we need to go to place the device.
So what kind of success have you seen with this thing already? The
success rate's about 97, 98%.
Wow.
So it works very well.
That's always good.
Yes, that's very good.
My goodness. PRMC's Dr. Stephen Hearn, thank you for some valuable information today.
You're quite welcome.
I guess I should give this back to you. Rather amazing little device.
Thank you for having me.
Thank you very much.